Welcome to another Health Announcement Spotlight. I'm Jody Tropiano, the Health Head of Content, and I have the pleasure of speaking with Todd Walrath, the CEO of ShiftMed. Todd, thanks for joining us today.
Thanks for having me.
So let's get into it. Given the persistent staffing challenges healthcare facilities are facing, how does ShiftMed's approach to workforce management address the unique needs of health systems?
Well, historically, hospitals have relied on contract and travel labor for the majority of their needs. We saw during COVID a huge increase in the demand for travel nurses and the huge increase in budget and expense associated with that. ShiftMed takes a very different approach. First of all, we have software tools that help a hospital system leverage their own workers as the first line of defense. Many of the workers in a hospital system are working less than 40 hours a week, and we're able to use our technology to allow them to pick up extra shifts if they're interested. The second line of defense is really a per diem on-demand approach. Instead of contracting with a travel nurse to now relocate, get set up in a hotel, pay the premium of having to contract with them for 13 weeks at a time, you can literally post the needs in single shift increments and get those shifts consumed by an on-demand workforce. ShiftMed works with hospital systems on a local basis, and we get thousands of local workers. Some of them will work part-time. Some of them, their main work experience will be just in that hospital. And we can fill up a large portion of their needs through local workers, which are cheaper and more on the ready. And then finally, there still will be travel needs that are needed, but that should be the last line of defense, not the first line of defense. So that's one of the ways that we've been able to differentiate ourselves and really educate health systems that there is a different way to get their needs filled on an ongoing basis.
Mm-hmm. And speaking of those needs, one key need for health executives has been addressing the dropping recruitment and retention numbers. So how has ShiftMed worked with health systems to boost these numbers?
Yes, one of the things that's unique about ShiftMed as well is we allow you to hire any of the workers on our platform on a full-time basis for free. So now you're able to have a credentialed worker who's already been working with your team and make a decision about whether you'd like to extend an offer to them on a full-time basis. Also, the typical health system that we work with has a pretty long onboarding time for new workers. Our technology cuts about 20% of that onboarding time out, so you're not losing new candidates. A nurse graduates from nursing school, they want to get working right away. They don't want to hear that you have a 7-week onboarding time and that they can start working now in October instead of September, right? So that's important. I ask hospital executives, can your workforce claim shifts 24 hours a day, 7 days a week? Most of them say, well, no, of course they can't, because we're posting that on an internal system or on the unit or on a whiteboard in some cases, on a clipboard, a variety of traditional ways that those shifts get exposed to workers. And now when you can literally be sitting in your living room on a Sunday and planning out the next couple of weeks of extra shifts that you might like to pick up, even though you're already on a regular schedule within the hospital system, being able to pick up an extra shift or two can be all the difference in that satisfaction. So rather than saying, well, partner with us because we have all this great technology, we now say, we understand that the last thing you want to do is use contingent labor. You'd rather use your own workers first, and we give them the tools to do that. So that's, I think, a very unique aspect of the value proposition that ShiftMed is offering healthcare systems today.
So can you tell us a bit more about those partnerships, why they've been so beneficial, and any highlights about those specific collaborations?
In the case of SSM, which is one of our larger clients based in the St. Louis area, they're saving $85 million in 2023 just on travel versus previous years. So that is real money at any, even for a large health system. And, we'd like to think that we're not just saving the money, but we're also helping change the collaboration and their teams and the culture within those teams so that they can get better patient outcomes. And because we create a little more flexibility in this system, we're able to attract workers like that to get our hospitals the patients they need. And we've been very successful. We've signed up 12 health systems already this year, geographically distributed: Louisiana Children's in Louisiana, Presbyterian in Albuquerque, Hennepin in Minneapolis, SSM in St. Louis, some of the larger clients that we've had a little more runway with so far year to date. But they're all benefiting from the same approach: less travel, more predictable expense, an on-demand component, and an internal workforce management component, managing your float pool, delivering a mobile app with your own brand on it if you're Presbyterian Healthcare in Albuquerque.
Well, you're addressing a really substantial problem in a smart and efficient way. So I'm not shocked that you have all those amazing partners. Thank you so much, Todd, for joining us. It's been a pleasure learning about ShiftMed, and hope to chat with you again in the future.
All right, Jody, thanks for having us. Appreciate it.